Caffeine withdrawal headaches. The symptoms are typically throbbing headaches caused by rebound dilation of blood vessels that occur several days after consumption of multiple days, that is, after consumption of large quantities of caffeine, or people who are regular consumers of caffeine who have a cessation of caffeine for one reason or another. Have a caffeine withdrawal headache. Typically, these headaches are also relieved by caffeine, and they will, after some period of time, usually resolve if the patient completely is abstinent from caffeine. Alternatively, most patients who experience this may find it easier to simply taper off of the caffeine. This can be done in several ways. One is if they are drinking 4 or 6 cups of coffee a day, each week just reduce that by 1. I do have some patients who have told me, though, that they like to drink that number of cups of coffee, and they don't want to change the number of cups of coffee because of the habit of drinking. But for those patients, some of them would accept a alternative option, which would be to make coffee with gradually decreasing amounts of caffeine. If they make their own coffee in a coffee pot, this can be done by slowly changing the proportion of decaffeinated to caffeinated beans that are mixed in. Some patients won't like to do that, or get their coffee from Starbucks or something of that sort. In those patients, you can order, if they're getting coffee in that fashion, you can ask for the person producing your coffee to mix, say, 3/4 caffeinated and 1/4 decaffeinated, and then a week or two later switch to half caffeinated and half decaffeinated, and so on, gradually tapering down the percentage of caffeine without reducing the number of drinks that they have a day. This also can occur with a lot of soda drinks nowadays, Mountain Dew, colas, or other caffeinated beverages that you find quite a lot of lately. So we used to ask people about coffee and tea, looking for caffeine, but now I ask about caffeinated beverages, including soda, when I do a discussion with the patient to examine how much caffeine they're taking.